Welcome to this week's edition of the Yamhill Leadership Roundtable, and we have with us Miriam Vargas Corona, Executive Director of Unidos Bridging Communities, and we have Howie Harkema from Encompass Yamhill Valley, and I'm Casey Kula, Yamhill County Commissioner. And I asked Miriam to join us because she has been busy in the last 15 months, and the last time we heard from her, I think, was in May of last year. So I'd love to hear what all you've been doing, because every once in a while I'll hear that you're helping this vaccine clinic, or you're working on this project, the Worker Relief Fund. But welcome, and tell us what you had to tell us today.
Well, thank you for inviting me. I'm really glad that we're getting requests to share about what's going on. It's always helpful to have partners and allies to get the word out. So I wanted to first just give a brief overview of who Unidos Bridging Community is. We are a community-based organization serving specifically the Latinx communities of Yamhill County. Our office is in downtown McMinnville, and we've been in organization since 2011, excuse me. We started as a community group and slowly grew to a nonprofit. We are now a team of 7, and so we are excited that we are growing to cover more of our communities in the county. So just to give some context about who our population is, the Latinx communities in Yamhill County, we are 16.2% of the population. Once the census stats are released, I'm excited to see how much that has changed, but that's according to the last census that was done. In terms of the pandemic, I have seen that the Latinx communities, we have been up to 30% of the cases at one point, so not proportionately impacted compared to the general population. This morning I checked and we are 28% of the cases, so still pretty high. And 25% of the hospitalizations. In terms of testing, we are making up 9% of the testing, so that is also not proportionate. And during the pandemic, we decided to pivot our programming. Previously, we would do things around advocacy, leadership development, and community organizing, but since we saw that our population was being disproportionately hit by the virus, we decided, okay, we got to do more direct services and outreach specific to COVID. And so, our strategies are, going back to the basics, doing in-person outreach. So our staff tables outside of places where we know our community is. So the Mexican meat markets and the bakeries, church services on weekends, school supply pickup days, the food pantries when the food boxes are being distributed, etc. And so we've been distributing resource kits with information about financial relief information, PPE, local resources, etc. With a partnership through Promotores de Salud, which is a program that Providence runs where they train community members to be community health promoters. Every weekend for about a year, we were giving announcements at the biggest churches in the county to give updates about, what's going on in terms of cases, where to get testing. Now we're talking about where to go get vaccinated. And that's been really helpful to get the word out. And we have also taken advantage that our community really turns to social media for information about, different things. And so we've had Facebook Live events with guest speakers. We're on the Spanish radio stations doing interviews and presentations with our Latino Advocacy Coalition, which is a program that we have with organizations and agencies that serve the Latinx communities. We've been meeting monthly and talking about different ways that we can reach our population and identify what are the needs that we're seeing that we need to work together on. And so that's, in general, the outreach strategies that we've been using. Commissioner, you mentioned our involvement with the Oregon Worker Relief Fund. And that collaborative recently turned 1 year old. We celebrated our 1 year anniversary. And Unidos has been navigating applications for our community, and we've almost reached 1,600 applications that we've navigated. We continue to do that, and so that's been a big success for us. We fundraised some money to be able to do our own emergency relief fund, so we distributed over $35,000 just here locally. And people were really needing that. It continues to be a need. So, back when COVID first broke out in the community, we applied for a grant through the Oregon Health Authority, and we hired 3 field navigators dedicated to doing outreach to agriculture workers, farm workers. And so we have the county, we divided it into 3 areas. We have a field navigator dedicated to each area. They'll go to agriculture workplaces and, give talks right there. And then when people are still working about how to prevent the spread of COVID, when, there was a lot of testing going on, we would help people to know when Virginia Garcia was having their mass community testing events, when the county was having those, and then our staff would attend them. Each one of those, we had presence and distributed resource kits and PPE. To date, we've distributed over 56,000 face masks in the community and over 19,000 hand sanitizers. And so we've been really trying to push that out there anywhere and that people let us into their, workplaces and churches, stores, et cetera. We've received tremendous support from the community, and we're really thankful for that. Now that we are in full vaccine mode, our efforts have pivoted to ensuring that vaccines are barrier-free, that access is, just wide and broad. And so our outreach workers have been giving our Yamhill County Public Health team a list of agriculture employers that are willing to have on-site vaccination events, and we continue to refer those. And then we accompany them. When the events happen, our team is out there providing logistical support, whether it be interpretation, filling out consent forms, just anywhere that the support is needed, our team does that. And we're also accompanying Virginia Garcia Clinic. They're also providing these mobile vaccination events at different workplaces, and our team is there to provide support as well. And so one of the biggest things that we're, focused on is removing access barriers, information barriers. So one of the strategies that we have implemented is, back when the vaccine supply was limited, we started a partnership with public health to have direct access to the appointment links to make the online appointments. And so our staff and a group of volunteers, we opened up a dedicated phone line for the Spanish-speaking community to call us, and our team would book the appointments over the phone. And so that was, a way for us to remove that digital access barrier. And we were able to raise more awareness about the weekly vaccination opportunities that were available. And so I think that's been really successful. Excuse me. Now that there is more supply of vaccines, we can get a little bit more creative. And so we've really appreciated, the flexibility that public health and also our partners at Providence Newburgh, Virginia Garcia Clinics, everybody has just been wonderful and being just willing to go above and beyond to remove access barriers for our population. And we're now at the point where we're organizing our own targeted vaccination events. So we know that there's, the vaccination opportunities at Evergreen or the high school or even at the public health clinic. But what we've observed is that our community really needs these events to be in places where they feel safe, where they're at well-known locations, where they're able to come as a family. And so what we've done, we just wrapped up an event in May where we had an event at the St. James Catholic Church in McMinnville. And we really tried to organize it so that people were excited to come, and it seemed like a fun event. And so we did it on a Saturday, midday, between 11 to 3. We said, come. We're going to take walk-ups. You don't need an appointment. Just come as a family. And we asked public health, can you please provide 2 vaccines for us? We want to give people the opportunity to choose which vaccine they want to receive. And they said, totally. And we provided the Johnson & Johnson vaccine for folks that just want to get 1 dose, and the Pfizer vaccine. One, because we wanted to give folks an opportunity who were still a little bit unsure if Johnson & Johnson was for them, and because we're tailoring this to families, give adolescents that are able to get the Pfizer vaccine the opportunity to get vaccinated. And so that, I think, was really important. During the event, we observed that parents who work on weekends or have odd hours, they asked us if we could vaccinate their child without their presence there. And so having that ability to vaccinate, 15 and up without the parent there, being able to give, their own consent, that is really important for our population because parents often can't be there. We are also looking into having, what are some ways that we can support parents of the kids 12 to 14 who have these, odd working hours but they want to have their child vaccinated. We're trying to figure out how are some ways we can support those families. But in general, we had a really good response. We had live music, so the event was outdoors. We made sure, the band was away from our resource fair, away from the vaccination event. And we had about 10 partner organizations who came and tabled for the resource fair. And I think the community just really responded to that event where everybody was welcome to come, just no appointment necessary, families are welcome. And we also gave away gift certificates to support our local businesses, and people really, really appreciated that, both the community and our businesses. And so our next event will be in Newburgh. So Mayor Rodgers, you're welcome to drop by and say hi to people. And even for, Habitat, if Habitat wants to have a table there, we would love to have presence at the resource fair. This one will be at the St. Peter Catholic Church. And so, for anybody, local governments included, if they want to participate in the resource fair, we would love to have people there. And it's going to be the same setup, the flexibility of families, no appointments, same 2 vaccines. We just want to make sure that the community feels welcomed and that the vaccines are as accessible as possible. And we will offer the option to make an appointment. I know some people will need to go to work on a Saturday, and we want to help them be able to meet their work responsibilities and get vaccinated. So we're trying to be as flexible as possible for the community. So that's what we have going on right now. All of our outreach still continues. Our social media presence is going to continue. Agriculture worker outreach will continue. We're just adding on these vaccination events. And so I'm available for any questions, whether it be right now or after. Happy to talk about other ideas that people have.
Awesome. Well, thank you so much, Miriam. And you and the rest of Unidos are doing so much work. So much work. So thank you, first of all. Mayor Rodgers unmuted himself, so I'm just going to go to him. I have some questions, but I want to make sure he gets them in. And welcome,
All right,
Mayor.
great. Miriam, thank you. It's great to see you today, and thank you for your time. And of course, thank you for all of your good works. It's hugely important. So first, when is the Newburgh event? Do you know what day that is?
It's Saturday, July 12th.
July 12th. Okay, great.
Sorry. I think I have that wrong. July 17th. I'm sorry.
July 17th. Okay, awesome. And do you know what time it'll be?
11 to 3.
11 to 3 again?
And we will provide lunch for the Resource Fair partners.
Nice. Oh, well, there you go. For that alone, Habitat will be there, and that's good. All right, then a question. You know, we have calls every 2 weeks here in Newburgh with community partners during the pandemic and all, and some of the employers particularly are starting to get frustrated because they are seeing we're getting the vaccine resistance, so they're up to 55-65% of their employees, but can't seem to get the rest. Are you seeing resistance among your population?
What we've observed is people, there's some folks who say they don't want to get vaccinated. We've also observed that folks are choosing to delay when they get vaccinated, wanting to observe how, friends, family members react to the vaccine. Most of all, what we've learned, folks are concerned or fearful of what kind of reaction they'll have after receiving the vaccine. Am I going to get sick? Am I going to be able to go back to work? I have a chronic health condition. How am I going to adjust to the vaccine? So, for those folks, we just keep telling them, talk to your doctor, your medical provider, explain what your concern is if you have, if you've had an organ transplant, if you have diabetes or whatever, talk to your provider or call public health. We also encourage people to tune into the Facebook page for OHA. They created a Spanish page, and they almost on a weekly basis have these talks with the senior health advisors. So as much as we can, we try to promote these learning opportunities so that folks can have more information. And, all the community-based organizations that are grantees of OHA to do this outreach work, we're constantly hearing, we share with each other what are the concerns we're learning, and then we brainstorm, okay, well, how do we provide the education to respond to that specific need? So it's always helpful to us to hear from folks like you that also have communication with community members to understand what are the specific concerns. But most of all, I would say there's that fear of, well, how is my system going to react to the vaccine when I get it?
Thank you.
And then I actually had that question, which was, are people concerned about the having to potentially take time off? Because that's a national level. That's been a survey response.
Yeah, and I think that's why we've, been working towards bringing the vaccines where people are. So, initially, when there was limited supply and there was that phasing happening throughout the state, when it was the time for agriculture workers and essential workers to get vaccinated, that's why, honestly, hearing from other grantees throughout the state, I feel really confident to say that we have really good relationships in Yamhill County where a lot of partnership has happened. And I think that speaks to the level of, trust and community building that organizations and, public health, Providence, Virginia Garcia, have a really good working relationship. And I always brag that, we don't have a problem with partnering here. I think everybody has been really helpful, like I said, willing to go above and beyond to make sure vaccines are getting to people and to reduce barriers.
Super great to hear. Howie's got a question for you, I think.
I have a twofold question for you, Miriam. First of all, what has been the biggest challenge for the last 15 months that we've been in the pandemic? And how are you reaching out to the shut-ins that you know are out there?
I think one of the biggest challenges has been our communities receiving updates, and information is changing almost on a weekly basis. There's a delay in receiving that information, just for the simple fact that most of our community still prefers Spanish, or still is able to receive information in Spanish mostly. And so creating those avenues of communication is one of our priorities, and that's why we try to have a multi-prong approach of how we are sharing information, whether it be in person, social media. When the vaccines became available, because it was such limited supply and it was done in phases, we actually had phone banking going on. We were calling one by one, our database of hundreds and hundreds of people that we've served over the years. And so it really takes us being creative and going back to the basics of, reaching to people in the ways that I mentioned. We can't, for our population, it doesn't work to just put something on a website or to put something in the news register or the Newberg, the graphic, I think. Did I say that right? And so, we can't use those traditional methods of communication that would work for, monolingual English speakers. There's limited Spanish stations for the radio. In terms of public TV, there is none locally that offers programming in Spanish. I think maybe in Salem they might have something. But for Yamhill County, that's not available. There's, the Portland-based local TV channel, but a lot of the COVID stuff that they share is from the Portland or the Multnomah County area. So it really takes more effort for us in the Willamette Valley to develop the content. So, I have one of our team members, I think she's become an expert in writing scripts because that's often what we have to do. We've become graphic designers now. You just have to figure out. I think our team has become, just multi-skilled people because we've had to essentially start from scratch when it comes to communication.
And then Miriam, I have a couple of questions for you. One is that, forgive me, I don't remember the exact name of it, but I feel like it's the council that you were on at the statewide level that you were appointed to, which was like the Equity Task Force.
Racial Justice Council.
Thank you. How has your experience with that kind of improved, informed your work in the county and Unidos' work?
The Racial Justice Council has different subcommittees that focus on specific needs, whether it be health, environmental, economic opportunities, law enforcement and policing, education. And so I think it has really, personally, it's been a learning curve. Unidos has mostly been involved over the years in things that have to do with immigration or state policy that specifically affects, immigrants in terms of civil rights or access to, things that have to do more with like the enforcement of law. And I think my participation has inserted us, I would say, into other areas of policy in those different topics that I mentioned. In particular, I think we've become much more involved in terms of healthcare needs. So, excuse me. We have a staff member now that is dedicated to enrolling people in the Oregon Health Plan. And so that has been really helpful for us to understand how gaps in access to resources, services, opportunities, what they call, social determinants of health, where you live, what kind of job you have, what neighborhood experiences you have, social connections, all of that has to do with health. And so I think our experience getting really deep into the community needs during the pandemic has introduced us to more community members because there's so much need. Just alone, the financial relief need is huge. Again, I go back to the point about finding out what is available, finding out what are the updates, what programs does YCAP offer, St. Vincent, Love Inc., et cetera. They're still learning that our community needs to do to understand and be aware of the different resources locally, let alone what is available in the state. And so I think I'm really excited that I have more connections with statewide leaders, BIPOC leaders that are part of the Racial Justice Council to continue our involvement in these different areas, after the pandemic is not, the focus of Unidos.
Right, and that leads me, I guess, to my next question, which is what you really just started talking about, which was you did a big push, realizing how much need there was out there with coronavirus when it came to the community. Do you anticipate going back to like a slower, quieter kind of work, or is this what you're going to be doing from here on out? And I kind of hope that the second one is, because of how many people you've helped.
Well, like I said, I think the pandemic really, it's been a learning experience for us to understand what are the biggest needs in the community. The pandemic is, the effects are going to linger in our neighbors and their lives. And so I would really like for us to take the moment to listen to the community, have some listening sessions, have some, small group discussions with residents, and to understand, what are the, top 3 to 5 things that you're losing sleep over. What is your family most affected by? Where should we be directing our resources and community organizing to support you with that? Because if the community says, well, I'm really struggling with finding a job, it doesn't make sense for us to offer, as an example, a leadership workshop. We need to direct our resources as an organization to meet the community needs. And so I really see us taking that time to understand the community landscape, and further developing our relationships with the community. I really believe that we have been as successful as we have been during the pandemic and have reached the number of people that we have reached because of the relationships that we have cultivated over the years. When we do outreach, we're not just pasting flyers everywhere and sending, emails. We take the time to talk to people and develop relationships. I really want to praise, the leaders within the churches that have opened the doors to us, small business owners, principals and teachers at certain schools, staff at the different clinics. It's the people in the community who have helped us make our work a reality. Those relationships are invaluable. And just like we develop relationships with stakeholders, we need to develop those relationships with people in the community, families, parents, folks that have been here for generations and have seen how the changes have fluctuated. And so I think that will be a focus of our work moving forward. And then we can assess, okay, the community said X, Y, and Z are the needs. Let's dive deep and figure out how we're going to address this together, because it can't happen just with our staff. We need to have the commitment, and the ideas to the solutions need to come from the community itself. So that's how I see us moving forward.
Awesome, thank you. And then the next question, it's related because you gave a really comprehensive answer, which is, at Labor Day, we had frankly unprecedented wildfires followed by many weeks of smoke. And agricultural and outdoor workers were harmed more than anybody else. I would say that none of us were spared, but the people who had to be outside doing physical work. Have you? I'm sure that you were getting masks out to people all along. But what other work were you able to? How else were you able to help agricultural workers specifically during that time? Or how can we help agricultural workers going forward, especially with these unhealthy air situations?
Oh, that's a tough question. For sure, we were out there distributing the masks. A lot of folks were still expected to go to work. Some employers gave the flexibility of, we're not going to work because your safety is priority. So we're thankful for those out there. I go back to the need to make sure people know what resources are available to them. And for folks that needed to stop working, helping them understand, okay, here's some financial relief to help you get through the month, because, for some folks, missing work 1 or 3 days is a big impact for their family and their economic well-being. And so, that's how we help them to get through that period. But it was really hard because even our staff could not go out and bring the information to them because, their safety is also important. And so we turned to social media. We turned to, we're going to have a mass texting subscription and we're going to send text blasts out there. I'm not really sure. And maybe that's a conversation that we could have with employers to also understand how much can they do, or how flexible are they able to be, because I'm sure they also have, their economic needs, their logistical needs. I'm not really sure how to answer that question. I think it's a conversation that we need to have with employers as well.
Yeah, it really does seem like it. And it's 96 here at the farm, and it's very, very dry. And that doesn't mean that we're going to have an awful wildfire season, but it is something that we clearly all need to be aware of, especially for the people in our community who are working outside. So
one thing that I did notice when it comes to the wildfires specifically, not just for ag workers, but just in general, emergency management, if you will. There was very few information available in Spanish. The emergency alerts that people sign up for, I don't think that's widely known as a resource. And I'm not sure that the messages are bilingual. I think they were only in English. I remember asking somebody that was in the evacuation zone up in Newburgh in the Chehalem mountain area. They received a evacuation notice on their door. And I asked them, was that bilingual? And they said, no, it was only in English. So, I think it's making sure we take the time to review, the different steps that are taken during, a wildfire event, making sure that it's accessible for folks that don't speak English, I think is really important.
That's super helpful. Thank you. And I can pass on some of those thoughts too. It is challenging when it's an opt-in emergency alert and you have to go to a website and then you have to fill it out. And then if it's not in the language you primarily speak, that's yet another barrier. But especially with the emergency notices on the door, because those are the ones where it's like, this is urgently, immediately an emergency. Yeah. Mm-hmm. Thank you for that. Mayor Rodgers had another question.
Yeah, actually a comment or two, actually. So, on the Spanish language, McMinnville Community Media, maybe that's an angle for them to start doing public service announcements in Spanish. So if anybody at MCM is listening, there you go. So, and then, otherwise, thank you so much for, Miriam, for your help with the Equity Task Force. You mentioned that the one you're on the state, but you're also on one in Newburgh. Thank you, very much for your help with that. I think the next listening session is going to actually be at St. Peter's. I think that's the next one scheduled, so we'll do that. The other thing I was going to mention, we haven't spoken since, but the city budget, we should ratify it, I hope, on Monday the 7th. And in it, there are two positions that probably came directly from some of the work. And one you might have already heard, but a senior librarian, Spanish-speaking senior librarian, which is great, and also community outreach person, again, Spanish-speaking. So if we can get the word out for those positions through your channels, that would be awesome. So, and thank you again for all your help with that.
And congratulations to the city of Newburgh for that. I think that speaks to the commitment that leadership has to equity, investing in full-time positions dedicated to that in-person outreach. Super important. I think that's the best practice in terms of engaging with the Latinx population. Oftentimes when people need a resource or service, people are more comfortable doing that in person, like being able to talk to a real human and face to face. And especially for the library, I think it's become a hub of information. I've seen that both in the Newburgh one and in the McMinnville one. I think both libraries are, leaders in community engagement with the Latinx population. So congratulations, that's super exciting. And yes, we will help get the word out.
Awesome, thank you. And McMinnville Community Media says that if there are any videos, film footage, advertisements that are in Spanish, they are happy to run them for free. And they're happy to run them.
Thank you.
Miriam,
and I have met in...
You can now do video editing as another one of your staff's many talents.
Right. And I have met with the director of MCM in previous years, and they did offer to us, to teach us how to put on a show and work the equipment. Maybe I'll put that on our list of skills to add. So we are thankful for they have offered a partnership with us. So thank you.
That's awesome. I have one question, Miriam. Since we have two housing advocates here with us today, is what are you hearing from people about affordability of housing, accessibility, the ability to get housing with multiple bedrooms? Like, what are you hearing, and how can these folks here help?
Yeah, it's very common for families or individuals when they immigrate to stay for a while with another family. So multi-generational households are very common in immigrant communities. And, when we get phone calls from people looking for housing, generally it's single men who are needing just a room to rent. And we are really excited that the Housing Authority has a new development site in the works, and I believe, single people are one of the target populations, and we will be helping to get the word out because that seems to be the biggest need, housing for single adults. We know that, there are resources through organizations like the Housing Authority, and I hear that Habitat primarily in McMinnville has been serving the Latinx community. I'm not sure what the demographics are for clients in Newburgh, but I know that's a resource that is known in the community. Word of mouth is pretty successful. And so families will share with others that it's a really good program. And I think people are really interested in those. The Community Home Builders program has also been really popular with our community. And so people appreciate those programs where they're able to, pitch in, whether it's with their labor or, these, I'm not sure if this is available here, but I've heard in other areas where the IDA accounts have been really popular for folks that want to become homeowners. I think those kind of programs, I'm not sure if they're available here, but it would be really great to have that as a resource. But yeah, just like everybody else, affordability is really hard. And I think most of the time folks turn to apartments or mobile homes for opportunities to have their own housing unit per se, when they are ready to move on from doubling up with, a known family in the area.
Just one comment on the IDA program, particularly what I've heard, and Habitat families are the perfect, in my mind, perfect for, because there's education IDAs or home build or down payment assistance, home building, and business startups. So Habitat is, but over the years, Yamhill County has been oversubscribed for IDAs, unfortunately. So if there's any way we can advocate for more money for Yamhill County, that would be great, because I haven't been able to get any at all for our Habitat families here in Newburgh. So, and we've done pretty well on our outreach to the Latinx population here for Newburgh. We've done pretty well. So, but I would love to be able to offer those, because so many of our families are saving for kids going off to college, and that is a fantastic way to do it. So,
yeah, and that concept of saving up money, on a monthly basis. There's something like it in Spanish that it's called the tanda, and so at the end of a period you get that money back. So the concept is familiar to people. I agree with you, Mayor Rodgers, that if that were available here, I think a lot of people would take advantage of it.
Well, we should do a follow-up to figure out where we can advocate, because I've got a phone and I've got my fingers, so I can at least do some level of advocacy for it. But, okay. Howie, do you have any more questions for Miriam?
Yeah, I have one. Are you working with Salud at all?
They have participated in our Latino Advocacy Coalition meetings to share what they're hearing. We haven't directly participated in their outreach, but we know they have been coming to Yamhill County to provide the vaccines on site at different employers. So we do know who they are. We just haven't had the opportunity to partner with them. I think they have been focused on providing services at their physical location mostly, and they've just started to come out to do the mobile stuff.
Awesome. Well, Miriam, I know there may be more questions, but I wanted to make sure we got a big thank you to you for giving us an update. You have been so busy, and so many team members. And every time I talk to public health, for example, every time I talk to folks at Virginia Garcia, I hear about the work that you are doing. So thank you. Thank you so much.
Thank you for saying that. I will pass that on to our team. I just want to praise them so much and hope everybody knows that they've been putting a lot of work into all the outreach. And we are all, except for one of our team members, residents of Yamhill County. And so we're from the community. We live here. We are raising our kids here. So we are really committed to the work that we do. And I just want to make sure that I think, the leaders at Yamhill County Public Health, their team has been wonderful to work with. The team at Providence Newburgh, the Virginia Garcia Clinic team. I just want to praise them a lot as well, because we couldn't have been able to, bring access to testing and to the vaccines without them. We're doing the outreach work and helping with logistical support, but the providers really have been great to work with. And I always brag about our relationships that we have here. It's really what makes the difference.
Definitely. Well, thank you. Mayor Rodgers?
The other side of, To the other side of that, Miriam, is, thank you indeed, but if there's anything that we can do to make it easier to help, get things through, just please don't ever hesitate.
Thank you. Well, yeah, I mean, if you have friends, family members, neighbors who are ag employers, ag administrators, we're looking for those doors to open for us so we can come and give PPE, give resource info, let people know if you need a vaccine, we can help you find the most convenient one. We're looking for those connections. So, even manufacturing, that's another industry where a lot of our population works. So if you have those connections, we want to get in touch with people. So that's one way people can help. And of course, we always need volunteers at these events for logistical support. We have roles for Spanish and non-Spanish speakers. So if folks want to help in that way, like I mentioned, we raffle prizes. So if folks want to provide, gift certificates or items, water, snacks, we're always in need of those kind of things just to help make the experience a little bit nicer for people at these events.
Yeah, if you have something about the event in Newburgh, if you want to send it over, we'll make sure we get it out to to the Downtown Coalition, the Chamber of Commerce, and all these folks, and see who might be willing to participate. But that'd be great.
Okay. Yep, I will do that. I'll send an email with the flyer. Thank you.
Thank you.
Well, great. Thank you very much, Miriam. And please keep us posted on how we can help again on an ongoing basis. I really appreciate you joining us.
It was a pleasure. It's nice to see you all again. Hopefully we can see each other in person soon.
Yes, very soon, very soon. And thank you for doing your part and Unidos to get us further along there. It's huge.
You're welcome.
Yeah. All right, great. I'm going to go to Howie now. Howie, what would you like to share with community members?
Well, McMinnville Free Clinic is reopening for the first time in 15 months on Saturday, June 5th and Saturday, June 19th. We have all of our protocols in place for the COVID situation. We're doing things a little bit differently. So when you come into First Baptist Church at 9 o'clock or through 1 o'clock on those Saturdays, a person will greet you and take your temperature and do all the protocols, and then you'll get given to a reception who will take you straight up to the room that you're going to be in. Instead of a waiting room, you'll go directly into an office where the doctor will come and see you, and things are going to be different, but it's good to be reopening after all of us being out of work, so to speak, for the last 15 months. So we're really glad to be back in community in that way.
All right, great. Thank you, Howie. And Mayor Rodgers, what would you like to share with community members and with us?
All right. Thank you, Commissioner. And again, Casey, as always, thank you for doing this. I think it's great. I really greatly appreciate you, bringing folks together. I mentioned the budget, so that's, of course, that's big. It's big news always. So hopefully that'll go through on the 7th of June, our next meeting. Otherwise, it was a fairly quiet weekend, I think, in town. Okay, the 12th, good.
I was hoping. I was like, come on, earlier. June 12th is the new 12th.
Right. And then otherwise, pretty calm, long weekend, as far as I can tell. We had a very nice sort of event at Memorial Park yesterday for Memorial Day, and had so that was good. It was good to see, and I've got to give Sergeant Weaver, or Counselor Weaver from Dundee, credit. He did a lot of the speaking during the course of the event, and it was great. He referred back to sort of Civil War times and the times that we're going through now with dissent in the political world, and then did a great rendition of the Gettysburg Address, which I thought was particularly timely, and so that was good. And so for anybody who missed it this year, we'll, I'm sure, be doing it again next year, and so it was good to see those who did attend. But otherwise, we are hopefully moving along in Newburgh, so there you are.
Urban Renewal District too.
Yes, sir. Urban Renewal. That is right. Urban Renewal District. We're getting more. It looks like down at the riverfront, more things are starting to happen. We're talking actually about the annexation of that property, so that may be coming to you, Commissioner, in the not too distant future. So yeah, things are going along. Howie, we're going to have a call tomorrow, I think it is, about homelessness in the county, and so we'll see what. Again, that's another issue that we all need to be discussing. The election in Newburgh, we had that last week, and so we've got a couple of new people on both school board and in Parks and Rec board. Interesting, the number of people that turned out as candidates for that was quite amazing. So, and again, we're going to, again, the thing is, we all have to work together. All these taxing entities need to work together, county, city, etc., school district, CPRD, and we all need to work for the betterment of all of our citizens and the future of our community and our county. So there you are.
Absolutely. Yeah.
Rick, how's everything going vertical?
The vertical housing, yeah, I think that's gone through us. I think that has gone through City Council, so that is now a thing. So this is for anyone who doesn't know. It's the ability to have commercial on the first floor, residential above, and there's a tax abatement program for doing that. The real idea is, particularly for the downtown, 2nd Street and that area, to try to get more housing to help support downtown, the shops and businesses there. So, but yeah, that has gone through. And I think Doug Rucks, our community development director, I think his list of housing items, and Miriam as well, I think it's now down to about 52 items that we are tackling. So it's there's a long list, and unfortunately there's no silver bullet to solve the housing issue of affordability here. So we'll just have to keep after it. Yeah.
And get ourselves that motel, Project Turnkey motel property. So more on that. I hear we'll know more on Wednesday. In the meantime, I have to bug the speaker's office. All right, well, great. Thank you, Mayor. I do want to note that in this world where there's changing restrictions and guidance around coronavirus, we are still remain in the high risk status in Yamhill County, alas. Our numbers are slowly dropping, the number of cases. More positively, our test positivity rate is now at 2.2%. So it's very low relative to levels that are concerning to public health. And we are at, I believe, 58% of folks in Yamhill County who have at least one of their vaccination doses on board. So this is, again, still much lower than some other counties, but thanks to people like Miriam, we're going up slowly but surely. The talk is somewhere between the middle of June and the end of June is when the statewide altogether may reach 70%, which is when things may change as far as restrictions and guidance, what businesses can do indoors, possibly even masks. So cross your fingers for that one. I know it's been hard for business owners and employees at the front of businesses to explain to people all the changing guidance. So I'm very hopeful for that 70% number. But with that, are there any last thoughts? And Mayor Rodgers, you mentioned continuing to do this, and I am nothing if not persistent. Maybe not very creative, but I'm persistent. Which is why I was like, Miriam, you need to join us again, because I'm persistent. And thank you for that. I really appreciate it. All right, great. Well, folks, stay safe out there. And remember, everybody out in the audience, these folks are working for you every day. And if you have a need or a problem or something you can't figure out, reach out to one of us and we'll help you solve it. All right, thank you. And we'll see you next week.